John here. Titan Talk Tuesday has officially begun. Instagram just started here. I'm live on Facebook. So I'm going to wait a second and let everybody start joining in before we really start getting to everything that's going on in Titan land. It's because there's a lot going on in Titan. So I'm really excited, guys. Just back from how you guys doing? So we're talking about all the events that are coming up, guys. We're going to be talking about the therapy of the week, which is Titan Fat Burning Cream, how that helps. And it can help guys and females. What's up? How you guys doing? So, yeah. So, yesterday, if you guys didn't know, yesterday was my 11-year anniversary with my beautiful wife and partner and everything, Charisse Sikoris. So, she has been with me, and we have been through thick and thin together. And we are still here, and we are banging it out. So, I'm really, really thankful for that. I'm thankful for my family and everything else. I appreciate it, David. Thank you, man. Low progesterone symptoms. Yes, we can definitely get into that, Nicole, for sure. So low progesterone could be a variety of different things, and then we'll start getting to the events, stuff like that. But I definitely want to answer this question because progesterone could be a lot of different things. So anxiety levels, hair. There's a lot of different things that low progesterone can affect. What up, Punisher? My man, Pat. How you doing, brother? Did you catch a series this weekend? I definitely I binge watched Punisher 2, Season 2 on Netflix this weekend. In between events, you know, I had to get it. I'd fall asleep. I'd wake back up, and I'd start where I was at before. But an awesome series. It's very graphic, so if you don't like graphic, that's not the series for you. But if you do like action and graphic, and you like Marvel Comics, like I did growing up as a kid, because I'm about to be 38 next month. You know, that's not old to some people. Like I was talking to some guy, an awesome patient today that came through, and he's 55, and he looks amazing. But, you know, I told him my age, you know, like 38, ha, 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 you're still a baby. And no, listen, I'm still a baby in his eyes, but that is not the case because I'm getting close to 40, guys. So 40, I would say, is middle age nowadays. I would say 76 to 80%. 80 is the lifespan of what we're supposed to be at. So, yeah, episode 4, you got to catch up. What up, George? So at that point, all right, so let's talk about some of the events that are coming up. So we got some really, really cool stuff, guys. Especially this weekend. I want to just focus in on it real quick. So this weekend, it's really cool. Titan Medical Center is the official sponsor of the 93.3 Gasparilla float. Now, if you don't know or you're not local to Tampa, Gasparilla is this huge parade they put on. Think about Mardi Gras times 10. All down like 5 miles of this road in front of the bay and the ocean. It's real cool. All like this pirate ship invades. All the boats are out there. It's just people galore. So for Titan Medical Center, 93.3 is a pretty dominant station here on the radio. So at that point, for us to get it and for it to be the Titan Medical Center, have our banners on there. We're going to be on there. Whole street team's going to be out there. It's going to be exciting. We're going to give away free shirts. We're going to have our own Titan, like, colored beads. You know, I wish I had the time. I would have got the logos, but it didn't happen. But it's second best. So we're going to be out there. So if you are local, we're going to be there. Gasparilla. We can't wait to see you guys. If not, it'll be on TV. We'll get plenty of pictures. I'm going to go live from there. So if you guys want to, tune in. And you guys will check it out. Really, really cool. I don't know if you guys have ever been to Gasparilla, but Gasparilla is definitely something to check out. If you haven't been to Tampa and you want to do something really, really exciting, Gasparilla is definitely a good time, okay? A really good time. And it's usually, they have a family parade, but we're going to be in the adult parade. And the adult parade will get adult life. That's all I can say. So it's going to be really, really cool. That's the one big event that's coming up. And that'll be this Saturday. And that'll be down Bayshore. If you're in Tampa, you already know. So, Titan Medical Center will be there. We will be there rocking it, representing. I'll be there. Charisse will be there. The whole crew, Art, all my Titanettes. Well, most of them anyway. And that's another thing. So, we are looking for some new Titanettes. I want girls that want to be a part of the Titan team. They want to represent Titan in full. I got awesome Titan gear for you guys. You guys will get exclusive therapies. You know, whatever it may be. So, you guys will get full support from Titan. So, if you're interested in that, you guys can email titanmedicalcenter@gmail.com. And at that point, you guys can, you know, Send some pictures, send something about yourself that sets you apart. The whole point of this is being able to represent Titan through your social media pages and stuff like that. Your experiences, your training, your regimens, using your Titan therapies, wearing the Titan clothing. That's what we want. We want people that are really, really, truly a part of the Titan family, because we will be here for you 100%, and that's what we expect back. So if you guys are interested, please, you guys got the email, do that now. We are taking applications for some new Titanettes. We got all kinds of cool events coming up. So this is a new one. This is really nice. PCA, if you guys don't know, Physical Culture Association. I think this will be the first bodybuilding show that we do this year. We do all kinds of federations. We do the NPC. We do PCA. We do everything. So Titan Medical Center likes to back everybody, especially in our community. And this is ran by Ian Harrison and Kevin Taylor. And at that point, these guys are awesome guys. Can't wait for this. It's going to be really, really cool. The Titan Classic, if you didn't see it. Titan Classic, right? Really good name, right? Titan. Gotta love it. Trying to take over, guys. So at that point, it's really going to be really, really cool. They showed, if you're seeing Facebook, you can see some of the really, really cool graphics that we're putting up here. Art's doing a great job. If you guys got any questions, all right, I'm currently with another medical group. I really like the info that is readily available with your company. So if you are with another medical group and they're not treating you the way they should be treating you, or going over your regimen, or you're not getting the results you're supposed to be getting or want, then then you have to say to yourself, is this the best thing I could be doing for myself? It might be saving me $10, but am I really feeling better? I talked to a guy this weekend, and we had like, I think 3 or 4 events this weekend. I talked to a guy, and we go to these events, guys. So if you guys want to come out to these events, more than likely, Sharice and I will be there. More than likely. And we always will announce that. So the guy comes up to me. The guy says, hey, listen. He goes, do you guys test for estradiol? Which is an estrogen test, right? So we do run that blood test in the full male panel, along with a whole bunch of other tests. And he's like, my primary care I'm getting testosterone through will not run the estrogen panel. So I know I have high estrogen. I'm getting these fat deposits, water retention. I'm irritable. At that point, that's what I need. So that point, he had to his wife was right next to him. She's like, I want him to feel better. He's not feeling right. I asked him how long he's been on the therapy. He tells me 2 years. I'm like, wow, man. I'm like, 2 years? He's like, I don't feel any different. I don't feel any better. I'm like, well, me, myself, I've been on testosterone for 10 years. So at that point, nobody really likes to inject themselves with a big needle, all right? That's just what it is, right? But we inject ourselves because we want the benefits. The benefits is everything that we're going there for. So if you really want the benefits of testosterone, you got to inject yourself. But if all the other things aren't correct and your body's not in a harmonic balance, per se, estrogen goes high, so you're not really feeling the best you can feel. What up, Pete? So at that point, you're feeling kind of crappy because maybe your estrogen's way too high. You have water retention, so you look like a tomato, like this. And at that point, you really don't want to feel like that. Libido could be messed up with high estrogen levels or low estrogen levels. People really want to assume sometimes, I don't want no estrogen. I don't want no estrogen. I'm going to take, there's an obscene amount of estrogen blockers, and that's no good either. We want to talk about that too. Don't just overdo estrogen blockers because you think you need to block this much testosterone. The best way you can do it is blood test. And blood testing will truly tell you the result or where you're at. So at that point, you have something, you're educated on what you're going to do next. You're not just playing a guessing game or playing Frankenstein with your body. Why? Why do it when you don't have to? That's the real question. Some people, it's either they just want to be cheap about it. I hate to say it, but if you can't spend $25 for an estrogen test to make sure your body's running correctly, then you're really cheaping yourself out. You're not cheaping anybody else out. Trust me. And that's the cheapest you're going to find it across the country. Can I get MK? All right, so that's a good question. Can I get MK677 without blood work? Yes. Old Superman, yes, you can. You can get MK677 without it. All you have to do is fill out the new patient paperwork. You do have to see a medical provider. Now, before I say that, The best thing you could do is, with this therapy, the MK677, is to blood test. Why don't you blood test your IGF-1 levels and see where they're at? That way you have a baseline. Don't be ignorant about it. Don't be uneducated about it. Do the right thing. Blood test, if you want to run just IGF-1 levels, it's $25 to do. Run the IGF-1 level test. At that point, you'll know where that IGF-1 level is at. And then after a month or two on the therapies, you'll know if it's really, really working for your body. And that you should be getting some of the results if it's really working too. So numbers should line up exactly with what you're feeling or what you're getting out result-wise. They usually coincide with each other. They're usually right there in a pair. So it's really not hard. That's usually when there's smoke, there's fire. So if there's a problem somewhere, you usually find it if they're not lining up together. Happy anniversary. Thanks, guys. I really appreciate it. Chrissy, thank you. Thank you, guys. Thank you. Yes, Eric, I had to go with the green screen. So if you're on Instagram, you're seeing this green screen, I'm sorry. I can't do the wonderful presentation that Facebook's getting right now that Art's putting together. It's a great presentation, and it shows everything that we're doing. So the cool graphics. If you guys got any more, good. How would I go about switching to Titan from my current medical group if I'm currently on testosterone or hormone replacement therapy? So that's a good question. I get this all the time. We get a lot of people that want to come over from their primary care physician or another clinic per se because, one, they don't know what they're doing. Their primary care is, and I don't mean that offensively, so I apologize for that. They're uneducated in hormone replacement therapy, so they're not providing the medications that maybe that patient may need, or they might not just be educated on how those hormones should work as far as that goes. And I have come across some of those doctors. Two, the hormone replacement center that they're possibly going to is cookie cuttered, and it's not personalized for them, and they're not getting the results they should be because something's off. So, your answer to your question, all you have to do is fill out the new patient paperwork, right? You need to get blood work within 60 days. If you have blood work within 60 days and all the test lab work that we need, then we can take that lab work and use that. We do need to get you in front of the medical provider as well. So, 3 things. 1, you need to fill out the new patient paperwork. 2, you need blood work within 60 days. All the labs that we require, whether we run them or you have them ran. 3, you need to see our medical doctor or medical provider. That way they're going to go over those labs. They're going to go over what you were currently on right now with that clinic. Maybe why you're wanting to change over because, maybe you're still having symptoms. Maybe you're not getting the results you should be getting. Maybe, something's off there. Maybe estrogen level's too high. So those are the 3 things. Now, 4 is this, because I do get this sometimes. You have to show the proof of your prescriptions. So it's really easy. It's a picture of the bottle with your name on it and the prescription. So if you really have a prescription, it's very simple to do. I get some guys that say, yeah, I have a prescription. And it's like somewhere from Mexico or, South America or something like that. Like, your name's not on the bottle, man. It's like, we can't take an underground or unregulated medication. The doctors just will not take a chance here on that. So if it's like that, it's unregulated and it would be black market per se, okay? Even if it came from a pharmacy in Mexico, it's not good and valid here in the United States. And I have had that question come up quite a few times, and that's the answer to that question. So, yeah, man, it's real simple, real easy, and we'll give you some discounts and stuff like that on some of the stuff. We provide a lot more than hormone replacement therapy for males and females. We do vitamin amino acid injectable therapies, which some of these guys, I promise you, are game changers, man. They will add on to what you are all about. So it's really, really cool in some of these. Our ECA Stack Plus, real ephedrine HCl, caffeine, aspirin, B12, and chromium. Great fat burning properties, great energy properties, great concentration properties. It's going to help improve what you're doing, hopefully. So that's really, really, really cool. Yeah, listen, it doesn't matter what medical group it is. We'll help you out. Just give us a call. We'll take care of you, okay? All right, so at that point, let's talk about this one because this one's a big one out there, I think. We talked about golf elbow and tennis elbow, right? Let's talk about tennis elbow today because golf elbow and tennis elbow are a little bit different in some of the things that you're going to do. So golf elbow is, basically the back right here. It's like a little, sorry guys. Gonna take off this jacket so you guys can kind of see here. Apologize.
Boom.
All right. So, so this right here, it's like the funny bone area, right? And people that have it, they know what it is, right? Tennis elbow is like usually right here, and people that have it know. So tennis elbow sucks, right? It sucks. Yes, we service Indiana, guys. We service nationwide. So Titan Medical Center services nationwide blood work, all our therapies. We will take care of you. We're a concierge medication or meds. We will help you out. We're concierge medicine, so anything that you need, we will help. So tennis elbow, let's get back to it right here because I've had it before. It sucks. And I tried everything, and everybody else, they're in the same boat as me. And the guy I talked to, Eric, this weekend at one of the events, has real bad tennis elbow. And he said, John, he said, you know, we were talking about BPC 157. And BPC 157 worked really, really great. I'm going to hold up and talk about that in a second because I want to talk about some things that you can do to maybe improve this without the BPC 157. Now, we'll get rid of it. I don't know because I use it in correlation with the BPC 157. So at that point, it kind of went hand in hand. Now, there was two things that I read up on. One and I've changed it, is the grip, and sometimes the grip your weights and stuff like that into the forearm will actually strain that, and that's when you will get this area. And a lot of people, it's, you know, triceps when they're going down, it's that motion, and it's right in here, and it's so painful, guys. It is painful. Even sometimes when you're doing biceps, which isn't that bad, it's more of the push down motion, and it's right here. So at that point, I started using wraps, and wraps have definitely used it and tightened the wrist. I haven't had any wrist problems, tweaks, any issues using wraps. It also has helped this area of not getting any more tennis elbow. So that was a big one. I shared that. What up? How you doing, Gennaro? All right, Scott was just in here, man. So at that point, yeah, so that's what I did. So definitely wraps helping that, pulling that thumb back. It did a lot. So I want to share my secrets and how I got over it. Number two, there was an exercise that you did when you put your hand, okay, and I'm going to put it against here. So you put your hand against the wall where your arm was extended, and at that point you were pushing with your fingertips. I don't know if you can see this, but you're pushing with your fingertips, and you can see a little bit of the forearm movement. So that was a big thing. Number three is that it's usually a forearm issue, and they say the forearm is not strong enough. I was talking to Eric. What up, Ursula? How you doing? So, yeah, 2 days. Awesome. I'm glad those wraps helped, Eric. So basically, listen, when I did this, the forearms was another thing. So it said work out your forearms while you have this issue. It will get rid of the problem. They will build back up stronger. And that's just what the issue was. I guess it's a forearm issue. So forearms are the key. Work out your forearms. Just get a weight and just go back up. You know, it's kind of like a motorcycle. You're revving up. Definitely with the hand exercise, you can YouTube it. That's why I found the video of that exercise getting done. Another thing is blood flow. A lot of people put the wraps on, and I used to put the wrap. And Eric had a really, really cool one this weekend, a Venom one. But sometimes that restricts blood flow. Now with BPC, the way it works, let's get into BPC. So BPC is natural as far as it comes from like the stomach juices, a protein in the gastric juices in your stomach. That's where BPC comes from. It's a 15-chain amino acid. And at that point, what it does is it's great for people that have ulcers or anti-ulcer. It's also great for regeneration properties is what they're starting to see. So it may help out in those areas. It may help out in wound healing. It could help in ligaments, muscle tears, golf elbow, tennis elbow. That's what I used for golf elbow and tennis elbow, along with any shoulder problems. Now, unfortunately for me, I have all the issues on one side, and it's because I'm right hand dominant. I pitched a lot and everything, a lot of sports. Shoulder is done, right? Golf elbow, tennis elbow, and the shoulder problem, when I went through this BPC and I was doing these videos right here, I actually got back to where I needed to be. And at that point, right before I started going back to that, I couldn't even push 25 pounds, guys. It was crazy. So anybody that asked me, like, you know, I was like very skeptical on BPC 157. But after using it and having a lot of patients use it and get a lot of great results, it is awesome, guys, for me. I'm going to just, in my opinion, awesome. Now, I want to put out this disclaimer. It's not going to heal everything. I get some crazy things. Will it help my hernia? Will it heal my hernia? Will it get a dislocated shoulder back in place? I mean, guys, come on. You know, let's use, you know, some thought. I mean, it's not, I know they call it the Wolverine healing drug, but it's not like that. And it's not going to repair certain things. It may help out with anti-inflammatory properties. Usually want to inject it to the area. So that's why ulcers and stuff like that, usually subcutaneous to the areas. For me, but it was directly like in shoulder, so I would inject directly in the shoulder here. Have no problems there, so it worked really well. Like I said, a lot of patients had some good results. With, you know, the tennis elbow, I injected, you know, right here subcutaneously. I did it morning and nighttime. And there's a couple of different ways you can do it. So the dosage can be increased. At that point, you can call us or text us. We offer BPC 157, and it is the therapy of the week, guys. So if you guys are looking for healing, BPC 157 is definitely the way to go. Some people pair it with a TB 500 and stuff like that, and we'll get into that next week because I want to talk about that as a therapy of the week, and you guys can hear about it. But BPC 157 I use single-handedly, and it worked really well for me. So joints, shoulder problems, ligaments, healing like wound healing, like after surgeries and stuff like that, really, really good. Breast augmentations, we've had some females use it with that for healing. Scarring properties and stuff like that, anti-scarring. There's been some really, really good stuff. So we've got some really cool therapies. Anything you guys are trying to accomplish, look better, feel better, perform better, we're definitely here for you guys. Please share this. If you're on Facebook, please share. At the bottom, left-hand side, please share it. If you're on Instagram, tag, and put those people in there, please, guys. Every Tuesday, Titan Talk Tuesday is going to be going on, so you know I'm here for you guys. All right? I want to talk about one more thing real quick. The Ultimate Health Bible, your guide to anti-aging, fat loss, and disease prevention. If you guys don't know, this is my book, me and Jeff Bahar. Came out a couple months ago. We've been doing really well. But at that point, I want you to go on Amazon, you can go on Kindle, Barnes & Nobles, you can purchase this. Now, I'm giving you a benefit for this, guys. I want all our patients, even our supporters, to really benefit from some of the stuff that's in here. Because it breaks out a lot of great information for you that I think that anybody from an amateur to a real seasoned person in health and nutrition will benefit from. I promise you, or I'll buy back the book, okay? But what I'm going to do anyway for you guys is if you buy this and you show me your proof of purchase or you send it in, if you're a patient, I will give you that value for the book. So you're basically getting the book for free, right? All you got to do is purchase it first. At that point, you can do it. If you're a supporter and you want like a t-shirt or something like that, I'll give you the $25 credit for the t-shirt or even possibly just send it out to you for free. So, Ultimate Health Bible. Go pick it up, guys. And I usually don't like to pump it, but there's a lot of great information that we put in here for you guys. I want everybody to benefit from it. And it's New Year's resolutions, like they're like right in the middle of it right now. I think we're getting one in our third week coming up. So at that point, you guys need to benefit, read up some stuff. You know you guys got some time, right? And if you guys want electronic, go Kindle. Cool. So that's done. Any other therapies you guys want me to talk about? What's up, guys? Oh, man, you guys are on it. Oh, yeah, that's right. We're going to hint at the contest. Thank you. All right. So, let's talk about it. People are always in this New Year's resolution, right? Oh, man, New Year's resolution. Transformation. I was talking to my man, Jeff. He was right. He was definitely right. He said, John, he said, you know what? Transformations are really, really cool, right? Because transformations, people change. They transform. I said, yeah, man, you know, that's what it's all about, right? You just really want to transform into something, right? He's like, yeah, but transformations can go to regressions. People can regress, and those transformations can change. So those transformations, they might not be, you know, they might not be permanent. And I said, yeah, you're right. You know, I guess, you know, people, you know, if they get lazy 10 years and they eat a whole bunch of fast food, McDonald's, and, you know, their health goes down the drain, I guess Yeah, they could look, 100% or, 180%, 100-degree difference, right? He said, yeah. So my point is he's like, dude, he's like, we got to have an evolution. I said, dude, you're right. Because evolution, we change completely. And there's no going back. We evolve into something so much different, right? And something that's more effective. That's where the adaptation comes in. And that's where the change to the healthy lifestyle and habits come into play. So at that point, you need to evolve. You don't need to transform. Transform's cool. Evolving is godlike. To a degree. I don't want to say, listen, I'm a very God-fearing person, so I'm not going to take it to that extent. But to a Greek god extent, let's put it to like that, to like a Zeus extent, right? You want to be a Greek titan, you want to be serious, evolve into it. Change one unhealthy habit to one positive, healthy habit, one at a time. I promise you, it will benefit you in a long, long run. So, the Titan contest is going to be evolving. And we like to be different here at Titan Medical Center. Everything we do, I promise you from the start, we've never tried to follow anybody. Like everybody tries to follow us, and I won't say anything. But we don't try to follow anybody. We always do our own thing. So, what we're going to do is we're going to do the after New Year's resolutions Titan Challenge, right? It's going to be the after New Year's resolution challenge. I'm going to announce it here in a couple weeks. All the patients, if you are a patient and get a therapy, you're going to be entered in automatically. So you guys don't have to pay for anything, right? There will be some stipulations on sending in your transformation pictures and dates and stuff like that. So at that point, you guys will get to earn possibly a couple $1,000s. I'm just working on the price right now, what I'm going to do. I'm going to do thousands of dollars in cash and prizes so you guys can take advantage of it. Whether it's credit or cash or whatever it may be. It's coming. So I would really just tell you to, just get on your transformation to transform and get ready to evolve. Because that's what it's going to be about. And that's what I'm looking for. I'm looking for somebody who has went through an evolution. And I posted, if you look on our Instagram and Facebook, a real big evolution transformation for Titan Tuesday. It was really big. That's why I posted it up there. I'm like, man, this girl did awesome work. Now, you don't have to go to that extent, but if you have something like that, that's going to be a story, I promise you. So we're going to see where you guys are at. Now, this should hit 2 of you guys out there demographic-wise. 1, some of you guys have been in the gym and you guys are still busting butt on your New Year's resolutions. You guys will have a head start. But your transformation picture has to be from the day of you starting. So, if you look real good in that transformation picture, you better go at the end, you better look a lot better because we're going to compare to the 2. So at that point, the person that's fell off of your New Year's resolution, here's for your little kick in the butt of motivation to get back in the gym. Get on your therapies and get moving so you can win the money. We got to win the money, right? We got to win the money. We got to win the prizes. You want to win it, so I want to give it to you guys. So I'm trying to motivate you guys. I'm trying to incentivize you guys so you guys will take it for real. I mean, usually there's money on the line. Usually I tell somebody like, hey, do this for your health. Do this for money. Oh, what do you want me to do? I'm like, oh, okay. So, all right. So do it, right? I'll do it myself. I'm like, hey, listen, you want to get stronger? Do push-ups. I'll give you $5. Oh, okay. Yeah. I mean, come on, man. I mean, so I'm trying to motivate you guys any way I can, right? So I definitely will. So evolve as a person, evolve and change your body for real. And getting those healthy habits, because at that point, once you create a lifestyle and once you get into that routine so much, you don't think about it. It's not a chore. It's not something negative. It's not a punishment. I mean, I live it every day, and I am really, really happy in what I do. So at that point, like I'm telling you, you can get into that mindset. And once you do and you start feeling better and you start doing good things and being positive like that, I'm telling you guys, man, it is awesome. It's a game changer mentally, physically you'll change, and a lot of good things will come your way, hopefully, man. I'm a big believer in that. So what you put out, you will get back to you tenfold. So be a positive person always in what you guys are doing. All right, guys. I think that I'm done unless you guys have any more questions for me. I went on my time span of 6:30. So that's right where I need to go. Is there anything up there? Thank you. I appreciate it, Dante. From skinny twig to Hulk, challenge accepted. Let's go. All right, guys. So you guys have heard all that. Listen, if you guys are on YouTube, please press subscribe. Please share it on your social medias too. Draw people into it. Tell them this is going to be educational. You might learn something. We'll give health tips out to people. Anything you guys want answered, DM us. We'll put it in the newsletter if you guys aren't getting that. Subscribe to it. Instagram, Facebook. Guys, follow us. Share the pages. Do us a favor. Help somebody out. Right? So, I'm John from Titan, guys. It's been a great Titan Talk Tuesday. We'll be coming at you a little bit more this week with some other details and some things coming on. We've got a lot more shows, NPC shows, PCA shows. We've got Europa coming up. Oh, God. We got some things planned for Europa. Orlando, here we come. I'll see you guys all later.